Health officials are now monitoring 3 measles cases across southeast Michigan.
It is potentially a deadly disease that's also preventable with a vaccine. These new cases are shining a new spotlight on declining vaccination rates.
So joining us now to answer some of your questions is Dr. Abdul El-Sayed. He's the director of Department of Health, Human and Veteran Services for Wayne County. Thank you for being here with us.
Thank you for having me, and thank you for covering a really important issue.
So, Dr. El-Sayed, let's start with how should we be thinking about this? How concerned are you over this growing number? It's small, just 3 right now, but it was just 1 a couple of weeks ago.
Yeah, and just remember that before that, we hadn't had a case in Michigan for 5 years, and now we've had 3 in just over a week now. So this is concerning. And if you're somebody out there who's been vaccinated or whose child's been vaccinated, you've got nothing to worry about. But if you're someone out there who's got a kid who can't be vaccinated, or you yourself haven't followed recommended public health and medical advice and haven't gotten vaccinated, this is certainly something to be worried about. And the reason why is because measles is the most infectious disease known to humankind. To put in perspective, we all understand the dynamics of COVID. For every 1 case of COVID, that case will go on in a susceptible population, people who haven't been vaccinated. That case will go on to produce another 4 cases. When it comes to measles, they go on to produce another 18. 9 out of 10 of unvaccinated people who are exposed to measles will get the disease. And so, yes, this is really concerning, and we need to be vigilant. Now, the most important thing people can do, go get vaccinated, protect yourself, protect your loved ones, do the things that you can to protect yourself and your loved ones, and let's not be caught off guard.
Sure, you mentioned COVID. That is something that recently sparked a lot of debate over vaccines. A lot of people still uneasy about that even now. In terms of measles, what are your thoughts on getting that vaccine and the importance and, letting some of that fear be cast to the side for the greater good?
Yeah, I want to be clear. Debate's not really the right word. On a debate, you have 2 different perspectives given the facts. When it comes to vaccines, there are the facts, and then there are people who want to mis and disinform the public about those facts. We know that measles vaccines are safe and effective. It's the reason why we haven't had to talk about measles for a very long time now, because those vaccines work. And up until just recently, most people got their kids vaccinated, and so we were all protected from this terrible virus that can cause illness, cause death in 3 out of 1,000 people who are infected, and certainly do so among our most vulnerable, our infants. And so the most important thing people can do is understand that anyone who's telling you that this is going to cause damage, that this is going to hurt you, what they're telling you is likely on the other side of some goal that they have to mis or disinform you, to break your belief in public trust and institutions that our parents and our parents' parents understood were there to protect us. And in some respects, when it comes to vaccines, they've almost been a victim of their own success. Like, we've forgotten what measles look like because they were so effective. But that requires people doing the thing that our parents and grandparents understood was obvious because they watched people they knew and loved die of measles. And so go get your vaccine. Don't pay attention to folks who are trying to tell you that you can't trust so-and-so and that there is a worry that you should have. At the end of the day, we know that measles is deadly. We know that the best thing we can do to protect ourselves against measles is get vaccinated. And the reason why we are now talking about measles again is because people are not getting vaccinated. And I worry about what that'll mean as more people potentially become ill and pass this disease on.
So, as you mentioned, until recently, the vaccination rates for measles, against measles, were pretty high. So if anyone is wondering, an adult perhaps, whether they received that vaccine, it was probably a long time ago, what can they do if they don't have those medical records anymore?
Yeah, those records still exist. Go to www.waynecounty.com/measles. There's a link on that site to check your records regarding whether or not you've been vaccinated. If you're wondering if your kid has been vaccinated, go ahead and talk to the pediatrician. Those records exist. Please do verify, right? Make sure that you got the vaccination that you expect you got. And once you do, you can have that peace of mind knowing that whatever happens moving forward with more measles cases coming to us from abroad, that you don't have to worry and that you're safe and secure.
We're already talking 3 cases just in southeast Michigan. Could you reiterate just the issues that could come with this and how serious that could be if people are hearing this and they're still choosing to not take those measures very seriously?
Yeah, I'll tell you this, 3 out of every 1,000 people who get the disease will die of it. And then even if folks recover, there is a risk of long-term complications in the form of a nearly universally fatal neurological illness that can reoccur a decade on after having recovered. And that is just the short term. And I'll tell you this, as a father of a child who just turned 1, I'm so thankful that she was vaccinated against measles, got her MMR vaccine almost as soon as she turned 1. And now I don't have to worry about whether or not she's susceptible. But for a lot of kids born in the last year, infants, our most vulnerable people, they can't be vaccinated. Their immune systems just don't react the same way. And so when we vaccinate, we're not just vaccinating ourselves and our kids, we're protecting the most vulnerable in our communities. So it's critical that people do the right thing. I'm grateful that my kid's in the vaccination window. My kids have been vaccinated. I, of course, have been vaccinated. I wouldn't ask people to do something I didn't do.
Yeah, really helps put it in perspective. Wayne County Health Director, Dr. Abdul El-Sayed, thanks so much for joining us today.
Thank you.